You came to us because you're having difficulty with blurry vision and nighttime glare. And after our examination, it's very clear to us that you have cataracts in both eyes. You've seen the videotape on cataract surgery, but I want to go over a few things just so you understand. A cataract is a cloudy lens within the eye. And our job is to painlessly remove that cloudy lens, replace it with a new lens called a lens implant, and in so doing, I expect that you'll be seeing much better. Now, the operation that we do is one eye at a time, and we do it upstairs in our surgery center, the Surgery Center of Michigan. You'll be in our surgery center for about 2 hours, but the operation takes about 10 or 15 minutes. Now, I want to reassure you there is no pain during the operation. Before the operation, most patients are just a little bit nervous, and I'm sure you will be as well. We'll give you something to calm your nerves, either by mouth or in an intravenous injection, and that'll make you relaxed. You'll be awake during the operation, but you won't have any pain. We'll give you eye drops to freeze your eye, and there'll be a device that will hold your eye open very wide so it won't be possible for you to blink. Patients are often very worried, what if I blink? And I can assure you that it's not possible to blink. All we ask you to do during the operation is look up at a very bright light. What you'll see are swirling colors, a very bright light. You may feel some eye drops or feel some pressure, but you should have no pain. You won't actually see what I'm doing. Everything will be out of focus. The operation takes about 10 minutes, and then we'll take you back to the recovery room. We'll give you something to eat or drink, and within a few minutes, you're on your way home. You really don't have any limitation in your activities after the operation. You can go back to all your normal activities, but the most important thing is that allow time for your eye to heal. The day after the operation, your vision oftentimes will be very blurry, and this is normal. It may take a day or 2 or even 3 for your vision to clear up, but I'm very confident that a week later your vision will be much better, and then we'll be ready to do your second cataract operation. Now, when we do a cataract operation, we're going to place an artificial lens in your eye. That artificial lens, or lens implant, comes in one of 2 basic types. The first type is called a monofocal, single focus implant, or you could have a multifocal implant. In a single focus implant, we can choose, based on your interest, of giving you good vision without glasses for distance, or for near, or for somewhere in between. But because it is a single focus implant, it will only give you clear focus at one distance. The other distances, you will need glasses to see clearly. I can tell you that most patients prefer to have good walking around vision, good distance vision without glasses, and then they supplement that with reading glasses. An alternative way of doing this is to use a multifocal implant. In my experience, most patients that have the multifocal implant do not need glasses for distance or for near. Now, it's possible you might wear glasses occasionally, but most of our patients function very well without glasses if they have the multifocal implant. One final thing that I wanted to talk to you about is the use of the femtosecond cataract laser. For the past year, we've been using the cataract laser in our surgeries, and I'm very, very happy with its use because it provides me and my patients greater accuracy and precision, and in my opinion, it is a safer operation, at least in my hands. What the laser does is takes small little micro movements that I normally would do by hand, and I've done thousands of times in the past, and it takes those movements and computerizes them. So it makes a perfectly round circle, better than any human could possibly make. It softens the lens to make it easier to remove, and then if you have any mild astigmatism, it can treat the astigmatism at the same time. So I recommend the cataract laser in your case, as I do in almost all cases. So I'm very excited for you. I think you have the possibility for much improved vision, and we'd love to help you see better.